Telemedicine is the remote delivery of healthcare services and clinical information using telecommunications technology. It has the potential to both reduce the cost of care as well as improve the quality of care for patients. The current implementation of telemedicine is relatively limited. Only 7% of patients actually use telemedicine systems, and about 3 to 11% of professionals frequently administer remote monitoring systems. Despite the limited implementation, there is a great demand to use telemedicine services. 70% of patients with chronic illnesses would be willing to use telemedicine, and 80% of general practitioners, specialists, and nurses would be willing to use telemedicine. This chart from a 2009 Deloitte study, a survey of healthcare consumers, shows that about 2 out of 3, 64%, of Americans are interested in home monitoring technologies to improve their overall health or to manage a chronic condition. The interest among seniors was even greater, with about 76% of them interested in using such technology, and even among Generation Y, which is a younger age demographic that is not yet concerned about managing chronic illness, about 51% of that demographic group was interested in using telemonitoring technology, presumably with the desire of improving general health. There are 3 main types of telemedicine services. There's store and forward, remote monitoring, and real-time interactive services. Store and forward is when acquired medical data is collected and then transmitted to medical professionals for assessment offline when the professional has the time to analyze the data. Only one party needs to be present at a time. This is referred to as asynchronous telemedicine. This would not be used in a case such as a video consultation. However, in a case where data could be sent to a medical professional, analyzed, and a response could later be sent via voicemail, email, or some other technology. This form of telemedicine is commonly used within dermatology, radiology, and pathology specialties. Remote monitoring technology is used by medical professionals to monitor a patient by using remote technology. It's most commonly used for managing specific chronic illnesses such as heart disease, diabetes, asthma, dementia, and other similar chronic illnesses. While a lot of remote monitoring technology occurs through specific medical devices issued to patients from providers, there's been a growing trend to implement remote monitoring software into mobile devices such as smartphones and tablets, which many patients may already possess. One example of this can be seen in the screenshots below. It's an iPhone and iPad application called AirStrip, which enables clinicians who care for patients to monitor vital signs of their patients. Clinicians could check on their patients, review their vitals, cardiac waveforms, labs, medications, intakes and outputs, and allergies, all within seconds of them being recorded. The last type of telemedicine is real-time interactive telemedicine, which is used to provide real-time interactions between patients and medical professionals. It's referred to as synchronous telemedicine and is currently the most utilized form of telemedicine. One of the most commonly used forms of real-time interactive telemedicine is remote consultations between patients and medical professionals, usually using video conferencing technology. One big use of telemedicine technology is for specialist telemedicine services, where telecardiology enables cardiologists to send ECGs electronically. Telepsychiatry enables video conferencing for patients residing in underserved areas in order to give them access to psychiatric services. Teleradiology is the ability to send radiographic images such as X-rays, CT scans, MR scans, PET scans, and so on from one location to another. A few other specialties involved in the use of telemedicine technology are pathology, dermatology, dentistry, audiology, ophthalmology. There are even telepharmacy and telenursing services which currently use telemonitoring technology as well. The primary benefit of the use of telemonitoring technology with these medical specialties enables a patient to achieve the highest quality of care without needing to see many different specialists, which may be located in different areas, as well as reducing the need to move a patient. At the forefront of telemedicine, and probably one of the largest potential future growth areas for telemedicine, is the use of telesurgery. Telesurgery enables surgeons to operate on patients hundreds, if not thousands, of miles away from where the surgeon is actually physically located. Surgeons use voice commands and a series of controls to actually physically operate on the patient through the use of robotic arms. There are several issues, however, that are still being worked out, such as issues with force feedback and time delay due to the nature of communication technology, as well as issues with depth perception due to the fact that a surgeon is looking through a camera as opposed to actually seeing the patient in front of them. We've talked a lot about patients and providers. Let's talk for a moment about payers, specifically Medicare, Medicaid, and private insurance. Medicare covers most remote radiology, pathology, and some cardiology physician services. Medicare also covers physician services using video conferencing for fee-for-service beneficiaries living in remote, rural areas. When it comes to Medicaid coverage, almost every state Medicaid plan covers at least some telemedicine services. Coverage varies greatly in terms of what's actually covered. The American Telemedicine Association has challenged each state to fully cover telemedicine. Private insurance also varies state by state. Currently, 20 states plus DC require that private insurers cover telehealth the same as in-person services. Insurers in other states cover at least some telehealth services and have expressed interest in expanding their telehealth coverage. Despite the many benefits of telemedicine technology, there are still some concerns. There are additional costs incurred from the implementation of telemedicine technology, especially for the cost of equipment and personnel required to run the equipment. There's also a concern about a decrease in the quality of service due to less human interaction and more of a reliance on technology. There's also the concern that protected health information may become compromised from using such technology, and also concerns about the quality of transmitted information. The American Telemedicine Association is an organization founded in 1993. They're a non-for-profit organization headquartered in Washington, D.C., and their mission is to promote professional, ethical, and equitable improvement in healthcare delivery through telecommunications and information technology. One of their roles is to educate government, payers, and the public about telemedicine. They also provide a clearinghouse of information and services for new and experienced professionals engaging in telemedicine. Another purpose they serve is to create a network of allied interests in medicine and technology. The ATA also serves to promote research, innovation, and education of telemedicine, and helps develop policies and standards for use in the telemedicine industry. One successful implementation of telemedicine occurred within the St. Vincent healthcare system in Montana. The American Academy of Pediatrics mandates that all head injuries need to be evaluated by a pediatric neurosurgeon. Most pediatric head injuries require a CT scan followed by 24 hours of observation, followed by a repeat CT scan. Prior to the implementation of telemedicine, children with serious head injuries needed to be transported to Denver, Colorado, as the CT scan was able to be done in Montana. However, the patient needed to be transported to the Children's Hospital of Colorado to complete the observation. The new telemedicine system allows the CT scan to occur in Montana. A neurosurgeon then reviews the CT scan and conducts a video assessment of the child. The pediatric neurosurgeon, in conjunction with the local trauma surgeon, then determines if the child can safely be discharged without the need for a 9-hour drive or $15,000 medevac to Denver. If the child requires transport to Children's Hospital of Colorado, the child can still conduct follow-up visits via telemedicine, saving money and time without compromising the quality of care. Another successful example of telemedicine implementation occurred within the mHealth system in Massachusetts. The Center of Connected Health at Partners Healthcare implemented a mobile health program to send customized text messages to their patients. At Lynn Community Health Center, in a medically underserved community in Massachusetts, a text message program for young, at-risk pregnant women was implemented. Informational and supportive text messages were sent throughout their pregnancies up to 2 months postpartum. The goal was to offer younger women who had limited support systems the added benefit of reminders and healthy pregnancy. Patients participating in this program received the recommended level of prenatal care 9% more than women who did not participate in the program. Such a program is very low cost, but greatly increases quality of care as well as potentially reducing expenses related to complicated pregnancies and births. In addition to these successful implementations of telemedicine, there are currently 200 telemedicine networks in operation in the United States, as well as 3,500 service sites. There are also nearly 1 million Americans using remote cardiac monitors as of 2011, and in 2011 the Veterans Administration provided over 300,000 remote consultations. Given these examples and statistics, coupled with the fact that there are more patients and providers interested in using telemedicine than are currently using it, it's easy to see how telemedicine technology is already here and is only going to continue to grow in prominence in the future, especially as technologies like remote surgery become more and more successful.